Diagnosis. You know very well the diagnosis of cancer. You will be taken for x-rays. These are radiations. And these radiations are going to cause more problems. There was a time I said that women who don't have cancer, the more they go for the checkups, the mammography all the time, they're exposing themselves to the radiations, the more they increase their risks of getting breast cancers. And you came after me guns blazing. I was like, I understand you because you have no identity. You are not part of the system. You will not understand what is happening in the system. I knew it. And I knew I'll hit you one day with this. So the more you go for the mammography, just look at yourself putting your breast there and being radiated. What do you think those radiations are going to cause? They are high intensity radiations that actually affect the cells. They cause mutations. Somebody's asking a very genuine question. This is Desmond. Doc, what of these vaccines? Leave alone the cow vaccines, bro. The vaccines themselves, and when I'll be talking about HPV vaccines in the prevention of cervical cancer, you will see what I'm talking about. So these vaccines that are being given to your livestock that are actually going to affect the mRNA of the livestock, you eat that meat, you have mutations, problems. And of course, that gentleman with the pot belly will be sitting there dictating the new guidelines for you treating your cancer that he actually brought. Allow our president to call us stupid because you're asking serious questions. Somebody is asking, so is the mammography good? Now, you see, these are the people that I actually talk about. They hear, they listen to respond. They don't listen to understand. They're just quick to type a comment because they want to be heard. You must listen to understand. We've just said the more you expose yourself to mammography, the worse your case. So unless you already have issues with your breast and now you have to do a diagnosis at that moment in time. But there are these people who will constantly go for a checkup every year. Oh, you know what? I just palpated my breast and I'm thinking I have a tumor. Umeweka matiti kwa kitu. Radiation. Radiation. I wish you had that BD when you're breastfeeding. I wish you had the same effort during breastfeeding. You are so afraid of the cancers because you've been sold the fear successfully. Anyway, so the diagnosis, of course, lab tests are going to come in handy. Of course, gene testings are going to come in handy. The biopsies are going to come in. The radiations and x-rays, the MRIs, the CT scans are going to come in handy. Remember, these diagnostics are not there to actually make you buy the fear. They're not even there for you to keep on going there to do the CT scan and all this just because you can afford it. Just because your company is giving you a health insurance and now you want to just utilize it. So you do a test every year. And this is also going to those people who have diabetes and have hypertension. Every time you're busy taking a blood pressure test, you go and take 2 shots of alcohol, you're taking a blood pressure test to see what is happening. You eat sugar, the next 10 minutes, you're taking a blood sugar test to see, oh, am I safe? When you find your blood sugars are low, you are running to eat more sugar. When you find they are high, you are running to take metformin. So if you have been diagnosed with diabetes or hypertension, sit back, do what you have to do. The job is in your kitchen. The job is not in you taking a blood pressure and blood sugar test every single day. A blood pressure test of 2 days in a week is enough for you. Mondays and Saturdays is enough. Just get the average and keep fixing the kitchen. But you've just started eating healthy today. I'm looking at pressure bado ziko juu. Daktari, my pressures are still up. Of course they are up. You didn't get pressures in one night. You will not lose them in one night. Kila saa siku hizi mpaka imekuwa fun. Every household has a blood sugar test machine, has a blood pressure test machine. We call them digital, but it doesn't have the tallow. It has seed oils. And then you are there. I eat 1 meal a day. 1 meal that has been deep fried in all these things. You've snacked the whole day. You're taking a blood sugar test, is still up. You're running to tell me, Doc, I was asking. I saw your video on TikTok saying, I was asking. No, you did not see my video. You're not my follower. You're not. You just bumped into one of my videos and you think I can help you. Book an appointment. And all of you know I have done justice. I've talked about most chronic conditions. I've done justice. So by the time you're picking that number from the internet coming to call me, my friend, alafu unaanza kusema, daktari anakaa hash. This doctor is hash. Hash. About hash. I just put you where you belong. Because you don't have an identity. You like using people. Hey, Wakenya. Hey, Kenyans like using people. That's why I told you that on Friday, during Identity Fridays, that I understand that most of you follow me because I give you value. I give you value. You don't follow me for no good reason. You follow me because I give value. If I stop giving value, I stop to exist. And that's how a man's life is. We're constantly cycling. We are constantly developing and changing and evolving and becoming better and providing value. So if I don't provide value, I'm supposed to go extinct. Mtakuwa mnasema, kulikuwa na daktari fulani hapa online alikuwa controversial. Hi doc, I love the live. How about breast ultrasound? Breast ultrasound has no radiations. That one is safe. But you see, you're again going to use an ultrasound as a diagnostic technique. You're not going to use an ultrasound for fun. Diagnostic techniques. So if you are having a problem already, and then you have to go through this diagnosis, well done. But if you're just going there for fun, be careful. Now, back to treatment. Ni controversial. There are even your doctors who are actually warning you against what I say. Achana huyo daktari ni controversial. They are so quick to actually shun what you're saying. You're telling them, by the way, I was looking at Dr. Lewi's video and he said this. What do you think about it? Achana huyo daktari ni controversial. Sasa hiyo daktari wako amelea tumbo kwa mapaja. Very fat, breathing like a pig. Shallow breathing. Daktari. Huwezi ona daktari hata Lewis hata video moja. That was a very controversial one. Then pulls a drawer and pops a pill. And then once you leave, he goes to the balcony, smoke cigarette because alikuwa ashakasirika. Do you know how smokers get angry for no good reason? And until they puff, you can even shake. Toka hapa unaongea Dr. Lewis hapa kwa nini? Get out. Huyu daktari anakuambia aje ati pressure iko reversible na nimekuwa nikikupatia dawa za pressure for 20 years hujapona. Sasa amekuambia ukule chakula healthy na unataka kufuata hiyo because you think I'm and then he becomes angry. So you think I'm doing this for fun, you are you a doctor? Now you become the patient instantly. Wewe ndo mgonjwa, mimi ndo daktari. Sikiza. Hiyo uoga tumetoa. We are out of fear. My friends, ask questions. Let him boil and let the tummy burst. Muulize maswali daktari, hii health wewe, kwani hii obesity ni nini? Daktari, why am I taking drugs for a lifetime that they are not changing anything? Ask questions. Now, treatments. I have talked about this multiple times, that anytime you walk into the system and you've been diagnosed with cancer, the three options that starts is surgery, and then radiation, and then chemotherapy. Now, they realize these three are not working. They pumped in something called immunotherapy, where they're using these immunoglobulins and things that are supposed to boost your immunity. So imagine this, that you eat foods that actually lower your immunity, and then you go to hospital, and then you get a diagnosis of cancer, and then they give you immunotherapy to boost your immunity. Who said that? If the vaccines failed in boosting the immune system, I got TB and I had a vaccine for TB. It's here, I think so, on my left hand. Yes, everybody has that BCG thing. But I still got TB, and then I was told, when I asked that question, I was told, sometimes it fades up down the system. You go to Moyale where people are, they have a lot of TB and theirs is resistant, so you got the TB. My friend, I took those drugs for 6 months. I was like, wah. Hey, Tawe. It's not easy to take medication. Nobody was designed to take medication for a lifetime. So surgery, number one. But surgery does good on tumors. Surgery does very well on tumors. Okay? So when you have a tumor, the benign ones, remember? The benign ones, you can actually remove them with surgery. If the immune system is now unable to handle them, you can actually do a surgery. Some of them you can do a radiation to shrink them, then do a surgery. But the interesting part is this. If you do a radiation, you're actually exerting high intensity of radiation at a specific center. So you expect, because radiation is not specific to the cancer cells, of course, it will target more of the cancer cells because they are rapidly multiplying. But it will also target your cells around that cancer, around that tumor. And now radiation is capable of actually initiating more mutations in those cells around that tumor. So of course, we're expecting another radiation or another chemotherapy session, right? So therefore, cancer is easily preventable than you think you're going to treat it. It's easy to prevent it because every single thing, you've said diagnostics expose you to more cancer. We've gone to radiation exposing you more to cancer. Now chemotherapy is coming in, and number one side effect of chemo is actually causing cancer. That's why pharmacists will wear this protective gear before they even mix that chemo. And then as they're doing that, the same nurse who is supposed to put it into your vein is wearing gloves and protective gear and carrying it on a tray, and then comes and pumps it into your bloodstream. And immediately gets into your bloodstream, you're vomiting. So you need another drug that is called ondansetron to prevent you from vomiting. Now you're losing electrolytes. You'll now need electrolyte replacement. More money, right? So if you think insurance is enough to actually help you treat cancer, you will clear up that insurance. You will again go back, and now you'll have to dig deeper into your pocket. And it's unfortunate that most people who have cancer, they die after they have drained their family's resources. You drain them resources. Wanauza shamba, wanakuja. Wanafanya nini, wanakuja. By the time you're dying, the system has taken a lot from you. So prevent it. You will save a lot of money and you will thank me later.